guys, we are now in the block number 2 and block number 3 with my candidate Sufyan Khan. And yeah, Sufyan Khan, it's all good with you. Can you hear me?
Yeah, I can hear you.
Perfect. That's amazing. Let's go. We have now our block number 2 and the block number 3. Okay. After that, we finish celebrations and that's all. Let's go. Question number 1 of the block number 2, Sufyan Khan. Let me know what is vestibular physiotherapy. Okay, let me know what is vestibular physiotherapy. What is that? You are capable to do, you are capable to provide these services or not? Go ahead, you have 5 minutes over here in this question. Go.
Yeah, vestibular rehabilitation. Yeah, vestibular. Yeah, I was getting my voice back on. Hello? I can't hear you. Hello?
Let's go. We are facing these technical issues and I need to mute for you to not listen your voice, but go ahead, I'm here.
Yeah. Well, vestibular rehabilitation is related to the balance related, and there are and also with the ears rehabilitation. It's like uh, it has symptoms of dizziness and balance problem due to the crystal which is present in the ear, and there are certain more symptoms of nystagmus like eye movement which can be treated through manual therapy, and certain maneuvers which can be treated with those maneuvers, and I am familiar to the vestibular rehabilitation in that context.
Okay, perfect. That's amazing. And yeah, let me know now question number 2 of the block 2 and 3. Let me know very quickly who is suitable for this vestibular rehabilitation. Do you think everybody is suitable for this kind of vestibular rehabilitation, or there is only one small, very small group of patients that are suitable for it? Go ahead.
Well, yeah, as a part of our curriculum and studies, we do go for this vestibular rehabilitation thing, not in general perspective, but it's like a brief and specific thing to our curriculum and part of studies, also with clinical practice. Yeah, I have seen that there are certain specialization within the vestibular rehabilitation, and to specialize more maneuvers and techniques to treat these disorders. There are multiple specialization within the this domain. Normal physiotherapists do create impact and treat these disorders, but for a wide spectrum disorder, yeah, we have to go for specialization or hands-on training to the clinics which are providing this vestibular rehabilitation to more indulge in practice and experience in that specific area.
Perfect. Well done. That's amazing. Uh, describe right now question. Pay attention over here. Question number 3 of the block 2 and block 3. Describe the symptoms. Which symptoms it's quite common you perceive, you observe in the patients that they need vestibular rehabilitation? What are the most common symptoms for clients that are passing for this process? You know what I mean? The clients really need vestibular rehabilitation. They are passing for troubles, they're passing for issues. What are the most common symptoms of that patients? Go ahead, 5 minutes.
Well, yeah, there are multiple symptoms that a patient go through if he is or she is having vestibular problem or problem within the ear or within the crystal. One of the symptom is dizziness. He feels like out of it's like they disbalance and it's like a dizziness sort of condition. Along with that, they do feel uh, vomiting sort of thing uh, during when the crystals move inaccurately within the canal. Along with that, they have uh, uh, different sort of eye movements like geotropic. It's like downward eye movement multiple, which is called nystagmus, or away lateral eye movement. If they have some certain sort of problem with the canal or within the like crystal. Along with that, yeah, if they have a certain hearing problem, they do tends to hear louder or long sound with a tuning fork. There are different issues related to either they are sensory or conductive issue of the ear, and these are the things and symptoms that a person usually have if they have certain vestibular disorders, like they have either sensory loss or a conductive loss. It's like they can hear through the bone conduction, or they can hear the voice or yes anything through the bone conduction. It's like a tuning fork we put over there, or either in the center we can determine through that either they have sensory loss or they have conductive loss. Along with that, they have difficult and abnormal eye movement, which is called nystagmus. It's like outside, either it's outside or it's geometric. It's the movement is towards the earth, uh, or the floor, or it's like towards the ceiling or sky of eye, of the movement of eyes. And yeah, and they usually feel dizziness, they usually feel vomiting sort of thing, and these are the symptoms.
Wow, well done, well done. Congratulations. Wow, that's that's a trouble, right? Hopefully you can support these guys in the future, in the near future. You can support these patients that are passing for troubles. They are passing for this, this ongoing process, problems, all this kind of problems that you mentioned before, and then they need to do treatment with vestibular physiotherapy. Okay, hopefully you can support them, you can help these guys. And yeah, let's go. Question 1, 2, 3, 4. Question number 4. Let's go. Question number 4. It's all about. It's you can see in the website of our clinic. Over here, we do have women's health physiotherapy. All right. Describe it very well, very quickly, and easy going. What is women's health physiotherapy? Which kind of women's health physiotherapy is that? What is that? I am a lady, I'm a woman. Okay. If I need in the future, hopefully, I don't need, but if I need in the future, just in case I need that treatment, which kind of treatment is that? Women's health physiotherapy. It's what exactly? What is that exactly? Go ahead, 5 minutes.
Well, yeah, there are multiple aspects of women's health related problems. One of them, it's which is a woman go through it's like pregnancy and postnatal and prenatal physiotherapy, which is provided either in the initial phase of the pregnancy and after the pregnancy, because during this time period, woman goes to the not only a mental level of conscious and also with the physical sort of thing. During this time period, she also changed its anatomical uh, changes, go through these anatomical changes, and uh, these are the one aspect of women's health or women's physical therapy, and the other aspect is like uh, pelvic floor or pelvic health related to the women. uh, these are the two aspects of women's health physiotherapy. One is like pregnancy sort of thing, which is like pre or post pregnancy, and second is like pelvic floor or pelvic health uh, physiotherapy, in which we usually uh, strengthen their pelvic muscle if they have urine inconsistency, and if they have weak pelvic floor, because it not only just stabilize the body but also plays important role in their sexual hygiene and sexual wellness.
All right, thank you, much appreciated. Well done. Question number 5. All right, question number 5, Sufyan Ken. We got 5 minutes. Let's go. Question number 5, Sufyan Ken. Who is this kind of therapist suitable for? Who is suitable for to start one treatment in this sector, women's health? Which kind of women's it's suitable? Sorry, who is suitable for, you know what I mean? Which kind of women's are suitable to start this treatment with physiotherapy? It's one specific group of women's, or everybody can do this treatment? Let me know.
Well, yeah, if in terms of pregnancy, normally uh, a woman go through these physiotherapy session, it's like they are going through mental change and also with the physical anatomical change in the body, uh, uh, before the pregnancy and after the pregnancy, because after the delivery muscles do weakens, and their, as we see during the pregnancy, their tummy is bloated. That also impact the muscles of the abdominal muscle, which plays important role in the stabilization of the body. These women usually, it's like normal to go for physiotherapy in a pregnancy. Along with that, it also helps to relieve in back pain during that period. Yeah, pregnancy is like a indication for physiotherapy. And the other thing is like if they have uncontrollable pelvic floor, or they are it's like they have inconsistency in urine, they can go through these physiotherapy sessions.